How can we take back our health in our democracy? Well, I was invited, along with a lot of other experts in prevention and wellness, to a White House forum on prevention and wellness in June of 2009. Now, as part of our effort to create true health care, we advocated for an interagency council to support, to coordinate, and to develop health promotion and wellness movements across all government agencies. In June 2010, President Obama established the National Council on Prevention, Health Promotion, and Public Health. And Senator Harkin actually nominated me for this presidential appointment to support this council. Now, it's a step in the right direction, but there's so much more we can do. Here's what I think we can do. We can send letters and we can send emails and messages to our elected representatives to support lots of different health initiatives, such as eliminating unhealthy foods from all schools, from childcare and healthcare facilities, and all government institutions. The government must establish rigorous standards for school nutrition that's actually consistent with current science through the USDA, which we don't have now. Similarly, we need to create nutrition programs for other public and government-run institutions like the military and the Veterans Administration and the Indian Health Service and community health centers. The government has a lot of capacity to create change. We need also to support lobby reform because we must change campaign finance laws so that corporate political donations from entities like Big Food and Big Farming and Big Pharma can no longer continue to control the political process. We should subsidize the production of fruits and vegetables and change the Farm Bill. Agricultural policies should support public health and encourage the production of fruits and vegetables, not commodity products like corn and soy. 80% of government subsidies presently go to corn and soy, which are used to create much of the junk food that we all consume. We need to rethink subsidies, and we need to provide more small farmers with support and a broader array of subsidies for fruits and vegetables. We also need to help incentivize supermarkets to open in food deserts and poor communities. Poverty and obesity go hand in hand. One reason for this is we see food deserts all around the nation. Poor people have the right to high-quality food too, and we need to provide and create ways for them to get it. We need to build the real cost of industrial food into the price. We need to include its impact on healthcare costs and lost productivity. We also should think about taxing sugar. We tax cigarettes and we tax alcohol, and it helps pay for prevention and treatment programs. And sugar is at least as addictive, if not more, than alcohol and cigarettes. Scientists have suggested a penny an ounce tax on sugar-sweetened beverages, and this would reduce sugar consumption, it would reduce obesity, and cut healthcare costs. And it's going to provide extra revenue to support programs for the prevention and treatment of obesity and chronic disease. We also need to create a public health advertising campaign that makes being healthy cool and sexy and exposes the subversive practices of big food, big farming, and big pharma. We should use advertising techniques that speak to the emotional needs of the consumers and children. We need to support the creation of a health corps. We should train 1 million community health workers and health champions in communities around the country by 2020. Through the act of getting healthy together, we can create a double revolution. We can change the medicine we do, which is changing it to lifestyle and functional medicine, and we can change how we do medicine. Make it in small groups that make behavioral sustained change possible. We need to create this new workforce of community health workers who would accompany us and support us as individuals in making better food choices, in lifestyle choices, and in cleaning up their homes and their workplaces, in cleaning up their schools, their faith-based communities, their organizations, and our environment.